Good day, Southeast Wisconsin. I'm David Todd, your host for the next half hour of CTSI Discovery Radio. How about I start by explaining what CTSI is? CTSI stands for the Clinical and Translational Science Institute of Southeast Wisconsin, or CTSI. What's unique about the CTSI is that we are a consortium of 4 leading academic institutions, including MSOE, as well as Marquette University, the Medical College of Wisconsin, and UW-Milwaukee, and 4 leading healthcare institutions: Froedtert Health System, Children's Hospital of Wisconsin, the Zablocki VA Medical Center, and the Blood Center of Wisconsin, all working together in collaboration, focusing their time and energy on translating scientific discoveries into new and novel ways to help better the health of us all throughout Wisconsin and indeed nationwide. Plus, all the work is done by the CTSI across multiple institutions, using the experience of each of the scientific investigators. The vision of CTSI is to be an integrated home for clinical and translational research that provides a borderless, collaborative, synergistic, and investigator-friendly research environment that offers easily accessible, cost-effective resources, service, and training for conducting the highest quality of research with the aim of tangibly improving the health of the citizens of Wisconsin and beyond. Working together, our goal is to move community health therapeutics and interventions into the hands of those who can use them the most, and do it better, faster, and more cost-effectively than our current system, which can take up to 15 years to create and deliver to patients and the communities in need. We think that's just too long. We also think that by coming to you, the community, we will get a better direction and ultimately better health for the people we serve. To tell us more about the translational science enterprises, we call it, here in Southeast Wisconsin, we've invited Dr. Joseph Kerschner, the Dean and Executive Vice President of the Medical College of Wisconsin and CTSI Board President, to talk with us today about why MCW saw a need for a CTSI here in Southeast Wisconsin. Welcome, Dean Kirschner.
Thank you for having me.
You bet. I'd like to ask you, as Dean of the region's only academic medical center, what does it mean to the Medical College of Wisconsin to be granted a Clinical and Translational Science Award from the National Institutes of Health?
Well, the Medical College of Wisconsin strives to be a national leader in education and research, and the CTSI is, I think, one of the hallmarks of that national leadership. Many people maybe don't understand what a CTSI is, but it really is an award that is only given to a handful of medical schools across the country. It's a mark of prestige. It's a mark of educational and research excellence. And so in having a CTSI, it provides us with an opportunity to do a number of different things. It really is the main engine for us at the Medical College of Wisconsin of translating our research from the bench to the bedside. And so many people understand the importance of research and generating knowledge, but the critical piece of this, and the critical piece of this from the National Institutes of Health standpoint, is the need to make sure that those discoveries get into the clinics, get into the operating rooms, get into the hands of physicians and providers to make a difference in the outcomes of patients. And so that's one of the main focuses of the CTSI, and having this award from the National Institutes of Health means that the people in Southeast Wisconsin have at their disposal a medical center, a medical school that is actively working on a daily basis to get those new discoveries to improve their lives and to improve their health. One of the things that's very unique about our CTSI is that we have a number of partners, and we were really the first CTSI in the country to have this concept of capitalizing on all of the intellectual research and educational expertise that exists in Southeast Wisconsin. So when we talk about the CTSI here, we talk about it as the CTSI of Southeast Wisconsin, although the award is run through the Medical College of Wisconsin. The CTSI really belongs to all of Southeast Wisconsin, and our partners are critical in everything that we do. So not only do we have partnerships with the other clinical engines that are in our neighborhood here, the Veterans Hospital, Zablocki VA Hospital here, Froedtert Hospital, and Children's Hospital, and the Blood Center, all clinical partners which are critical for our CTSI. And so those pieces are very important as we link, again, these translational outcomes that improve health in working with these hospital systems and the Blood Center. But then we also have educational entities that are with us as well that really enhance and make much more robust our educational and research programs. And so that includes MSOE, Marquette, and UWM. And so those partners are critical for us as we move forward. And this model of bringing all of these great partners in Southeast Wisconsin together puts us on a national stage, puts us on a stage of institutions such as Johns Hopkins, Harvard, Stanford, places that individuals know about. The other piece that's critical in having these partnerships is that it does allow us a wonderful platform to link into our communities. Some of the fantastic things that are being done within the CTSI include drug discoveries, include using bioinformatics to take health information and health data and use that in new ways to work together to deliver healthcare in a faster and more cost effective method. And so again, having all of these partnerships with the health systems and the other educational institutions really allows us to do that in an interdisciplinary way with outstanding quality. So I would just conclude by saying, as the chair of the board for the CTSI, one of the things that I'm really most proud of is how we work together as an institution, all with this single goal in mind of improving the health of the citizens of Wisconsin, particularly Southeast Wisconsin, to improve and make advances in knowledge and research for those citizens, and then to, on the educational front, train the next generation of physicians and scientists who will continue to carry that banner forward, which of course is one of the strong missions of the Medical College of Wisconsin and the other educational institutions that we work with.
Thank you, Dean Kirschner, for joining us. I'd like to welcome to the program Wisconsin Secretary of Veterans Affairs, John Scocos. Good day, Mr. Scocos.
Good afternoon. Thank you for having me on, David.
Thank you for joining us. I know you yourself are a veteran, and I know that you support approximately 400,000 vets here in Wisconsin. Can you tell me, what is the state doing to improve the system of care that we deliver, or are there any statewide initiatives in the works to improve the system?
I sure can. We're always looking for ways to better serve our veterans population and adapt to the problems that affect veterans. I'm acutely aware of the physical, mental, and psychological costs borne by the men and women serving in our country's conflicts, and these costs do not end with their active duty assignments. Reintegration bears its own costs. As veterans attempt to resume their varied roles in our civilian society, mother, father, son, daughter, friend, employee, student, and others, I can tell you from a personal experience that even under the best of circumstances, this transition is a difficult one. Of the veterans living in the state of Wisconsin, the number includes 128,273 Wisconsinites who joined the ranks of deployed or returning veterans since the Persian Gulf War in 1990. More than 50,000 of Wisconsin veterans suffer from some degree of disability related to their military duty, and a trend analysis reveal an increasing rate of physical and mental health disorders for personnel who are deployed in Iraq and in Afghanistan. Some of the most effective ways we help our veterans is through our many partnerships, throughout the state, and by informing veterans there is help out there for them and where to find it. And specifically, Wisconsin Department of Veterans Affairs has partnered with various agencies and organizations to host 67 veteran career and benefit fairs statewide over the past 4 years, serving nearly 14,000 veterans. Last year alone, over 4,000 veterans and spouses attended these career-related services. Each one of these events is a chance to reach veterans who need assistance, including those with medical issues such as PTSD, and connect them to the resources they need. And I believe, just recently our department partnered with SAMHSA, the Substance Abuse and Mental Health Service Administration, and the U.S. Department of Health and Human Resources. Mm-hmm. We brought together various government agencies and nonprofit organizations to elevate the discussion and identify how to improve the delivery of mental health services. We've learned there are a lot of different points where a veteran may access services, many which are not affiliated with the Veterans Administration. Those points of access, be they a state office, a county office, a nonprofit service provider, or a veteran's primary care physician, need to be educated to appropriately respond when a veteran is reaching out. We've started to break down the barriers and are building up relationships to make it easier to cross bureaucratic lines to ensure our veterans and their families are taken care of. We have a strong network of mental health and service providers in the areas of the state. It is not a small task to educate them, but a unique circumstances and experiences our veterans and their families. The effects of PTSD are wide-ranging. Likewise, there are a variety of factors that influence a veteran's ability to overcome and successfully live with PTSD. There is not a cookie-cutter solution, and we are working across functional service areas to develop a comprehensive approach to assist veterans and their families. There is an overall shortage, we know, of mental health care providers, particularly in rural areas of the state. This is a problem that extends beyond veterans and affects all Wisconsinites. Recently, we met with the State Medical Society to discuss how we can partner to improve physical and mental health care treatment to the thousands of Wisconsin veterans who do not obtain their health care from the federal VA for whatever reason.
Well, that sounds amazing. It sounds like the state, too, is really leaning on collaboration to really get the work done.
Definitely we are. We're working hard to assist these returning veterans, especially some of our veterans who have had 4 or 5 deployments and are now reintegrating back into the Wisconsin area and society in general.
Secretary Scocos, thank you so much for joining us and sharing what Wisconsin's doing to really better the lives of our veterans. I appreciate your time.
Thank you so much, David, for having me aboard your radio show today and helpfully moving forward, a way forward to help our returning veterans so we can meet their needs.
Thank you, sir.
Thank you. Bye-bye.
Now, let me introduce you to one of our CTSI researchers who is working to support our returning vets, Dr. Zeno Franco. Dr. Franco is an assistant professor in the Department of Family and Community Medicine at the Medical College of Wisconsin. He completed his training in clinical psychology at the National Center for Post-Traumatic Stress Disorder. He is also currently a board member of the International Association for Information Systems for Crisis Response and Management. Welcome, Dr. Franco.
Thanks, David, for having me.
As we just heard, you are a clinical psychologist trained in post-traumatic stress disorder. But can you tell us what led you to your interest in this area of science?
Sure. So a lot of things sort of happened for me around 9/11. So it really sort of changed my career trajectory. I was very interested in disaster mental health and post-traumatic stress disorder and just trying to address the problems that people face after a major crisis or a major war.
So talk to me about PTSD and who it really affects. How broad is the disorder and what kind of toll it can take on people?
Sure. So, I mean, it can be as simple as being in an automobile accident. If you have a traumatic experience, get hit by another car, sort of reliving that experience, maybe being afraid to drive through that same intersection where you got hit. One of the major problems that we face with PTSD is women who've been raped. We also face that same issue with military sexual trauma in the military. But what most people associate with PTSD is sort of the combat trauma aspects of it. So when we send service members abroad, they experience things that civilians probably will never experience, the horrificness of war. And they often bring those memories back and carry them for a long time. And sometimes, not all the time, sometimes those develop into really significant symptoms that we call PTSD.
Gotcha. And currently you're working on a CTSI pilot grant that's helping you address these issues in that specific group of veterans.
Yep. Yeah, and we're really, with this grant, focusing on high-risk veterans, so veterans who are diagnosed probably with PTSD and who maybe are getting into some trouble in any number of ways, either at work or they may have been referred for some criminal activity. Oftentimes those difficulties that they have reintegrating into civilian life come up in ways that are not really good for the community and not good for them either. And so we're trying to address high-risk behavior in those veterans that are suffering the most after they come back from war.
And this project you're working on is a real, true collaboration across a lot of the CTSI partner organizations, but also with the community. Can you tell me about your team? Because it's a really great, robust team on this.
You bet. So a lot of what we do in my department at the medical college is community engagement. And so I have had a long-term relationship with Dryhootch of America, which is a small nonprofit based here in Milwaukee. They actually have a facility right on Brady Street where they serve coffee to veterans. It's also open to the public. And upstairs they do programming for veterans that might not be available through the VA, for example, more sort of social, more supportive long-term engagement with other veterans. So they really focus on peer-to-peer support. So that's one aspect of our team. We also have Marquette University heavily involved on the technology side, and we'll probably get to that in a few minutes, I imagine. Also, UWM has the largest number of veteran students enrolled in any of the UW campuses, so they're a major partner in this process.
Oh, that I did not know.
And the VA is also part of the partnership as well. So we're trying to combine the resources and expertise of a number of different campuses that are part of the CTSI, as well as the community partners that we work with to deliver this intervention.
Joining us on the phone is Jada Reynolds, a veteran herself and peer mentor at Dryhootch of America here in Milwaukee. Welcome, Jada.
Good afternoon, David.
Thank you for joining us. I know as a peer mentor, you work with veterans on a daily basis. With this new smartphone technology, what are veterans really looking, how are they looking to use it? What do they really need in this kind of technology to make it effective for them?
A lot of our veterans need something that's going to be consistent, that gives them the ability to contact supportive services, with the push of a button, where they don't have to wait on the line, where they don't have to wait on hold, where they have the ability to communicate directly with someone that they are familiar with that can provide the necessary assistance in a crisis situation.
And for the people that have been kind of in this alpha stage of testing it with you, how have they been reacting to what they see in this app?
Everyone that has used the application, have felt that it was really good information. They wanted us to change some of the questions. So we did. We made it a lot more user-friendly. And, they feel like it's a great resource because it not only has been something that they've been able to use and receive support, but it'll be something that additional generations of veterans that, are returning home and need support are able to use as well.
And do you see this as really being a help to you as a mentor?
It is a help because we have individual peers that we work with, and we're able to track how they're doing from week to week just by staying in contact through this application. And with everyone having such busy lives and schedules, we're not always able to meet up at a specific time, but you're able to use this technology to stay connected.
Thank you so much for joining us, Ms. Reynolds. Again, we're speaking with Jada Reynolds from Dryhootch of America here in Milwaukee. Thanks for joining us.
Thank you.
So when a veteran actually has this mobile app in their hand, what will they be doing? What will they see? What's the therapeutic to it?
Sure. So one of the things, so there's a lot of different layers that we're trying to build in. So one of the layers for younger veterans coming back from war, oftentimes they've never experienced sort of civilian life. They may have gone into the military at 19 or 20. They're coming back into school, and now the military infrastructure isn't there to tell them what to do. And so one of the things that we do in the app is just to have check-ins. And so there's a calendar of days, and twice a week you need to check in with your peer mentor, and that's an assigned peer mentor. You have an established relationship with them. You provide a little bit of data about how you're doing, and the peer mentor can then kind of take a look at how things are going and intervene if they feel it's necessary. We're not saying that the app is the end-all be-all. It's really augmenting the social system that's already there. So that's one of the things. I think for the peer mentor also, right now, if we're tracking a veteran, if the peer mentors are tracking a veteran, they're doing it on paper. And so they really don't have access to real-time data. And so we're trying to put the power of information in the hands of the peer mentor so that they can intervene when necessary.
And I imagine that having that electronically helps the intervention or the peer mentor get to that problem faster.
Yep.
And intervene faster.
Yep. Yeah, absolutely.
And I imagine also because so many of the people that are coming back are young, technology is really their major interface to society.
Yeah, and we've even had a few veterans who we've interacted with. Right now, we're because we're building the app, we're doing some of this process on paper and in face-to-face, using face-to-face communication with the peer mentors. Some of the folks that are most troubled have actually told us we would very much participate in this if we only had to deal with the app, if we only had to do this online. Right now, we're not ready to talk to a person, and that's a scary situation as a clinician. That's something that I worry about. At the same time, those are the very people that we need to get to. And if the first step for them is to say, I'm willing to interact with a computer, but I'm not willing to meet you face to face, we need to learn how to do that better.
Gotcha. So I know that you're kind of in the alpha stage testing of this. You've had it in a couple hands of people that have given you some feedback on it.
Yep.
When do you hope to actually have this on the market?
Well, so, we are looking actually at a commercialization path for this, for some of the aspects of it. What we're trying to do this summer is to get it into beta testing and then to actually deploy a stable version of it in the fall of 2014 during the next school year for UWM. So again, our sort of target population is the student veterans at UWM for this round. So that's our sort of short-term goal. Ultimately, as you're saying, we're looking at trying to patent some of the pieces from this and also to take it into a full-scale commercialization pathway.
So when you do go to veterans and you are already established that there's a lot of them at UW Milwaukee, how are you engaging those people? How are you getting participants to try this out?
Sure. So one of the biggest things for doing community-based interventions is really building the partnership relationships. And so we sort of baked into some of the grants that we have this sort of high-level relationship with UWM, leadership around veterans issues. But we're also working sort of on the ground at this point, if you will, with the Maverick Center, which is sort of veteran-specific place on campus where veterans can come and spend some time without the rest of the student body there. And so that's one of the places where we're doing recruiting for this. Again, trying to sort of really tailor the message around younger veterans who are coming into the system.
Sounds like you're also taken some time to build some trust in that community as well.
Trust is a huge, huge piece. And so the Community Academic Partnership for Health that we're working through with Dryhootch of America has been in place since about 2009. And those trust pieces with the community are key to getting this done. Because ultimately, I can't go out there and do the recruiting, right? Because if they look at me and say, wow, you're a researcher, you're not like us. If we have a veteran do the recruiting, it goes a lot more smoothly.
That makes sense, doesn't it?
Yep.
And I think it was just this month that Apple, in a big production, as they always do, unveiled something called HealthKit as a mobile application that really seems to be trying to attract those people that are jumping on the health bandwagon,
Yep.
the people who are exercising and they want to make sure that their blood pressure is right, their health rate's right. A lot for, I imagine, weight loss and things like that.
You bet.
This is not like that.
No.
This is really a therapeutic. It's an intervention.
It's more of an intervention, and I think the other piece, too, is that there's a lot, I mean, as you say, there's a lot going on, and it's a really good thing that there's a lot going on right now in sort of health behavior detection using mobile technologies. That's one aspect of it. And we also think that the social aspect is also really key. Social support for, most veterans won't develop PTSD. A lot of veterans have difficulties reintegrating when they come back, whether that's on the job, whether that's with their family, getting sort of the pieces picked back up. And so they may not have full-blown PTSD, but they may need some more support. And so we're really saying, how can the mobile technology support that social process for veterans?
And I can only imagine that because it is an app, and much like many other apps, as it's rolled out, you can continue to roll out new versions of it to enhance features as you get communication back from your veterans and back from the community.
And that's exactly what these studies are designed to do, is to take that feedback and roll it into the product.
All right, Dr. Franco, do you have some time for a little fun and to help educate our listeners further about PTSD?
Always.
All right. Joining us is CBS 58 anchor Paul Piaskoski. Good afternoon, Paul.
Good afternoon. Glad to be here.
Excellent. Thanks for joining us. So, Paul, this is the part in our program where we play translational trivia. We'll ask you 3 questions, and you need to get 2 of them right to win. Today, you'll be playing on behalf of one of our Facebook friends, Lori Marks of Milwaukee, who will win a CTSI prize pack, including a CTSI pen, notebook coaster, and an 8-gig flash drive. You ready for question 1?
All set?
All right. Question 1 is, the term reliving describes one symptom of PTSD. Other symptoms of post-traumatic stress disorder may include A, avoidance, B, hyperarousal, C, emotional numbness, or D, all of the above.
I am going to go with all of the above.
I think that you got it.
Yep, that's right on.
I'm going to assume that your experience in the news media might have just tipped you off a bit on that one. So let's see.
Luck might have had more to do with it. But
Well, let's see if we can make it a little tougher for you then.
Okay.
Okay, here's question 2. And this one is a science or fiction question. So your answer should be science or fiction.
Gotcha.
Question 2. More women than men suffer from PTSD. Science or fiction?
I'm going to say fiction.
That would be wrong.
Sorry, Paul.
Dr. Franco, why don't you tell us why that is incorrect?
Well, I think there's just, this gets really to the sort of sexual trauma issue, and I think also just sort of abuse across the board. So, I mean, when we think about sort of PTSD awareness, we think about PTSD oftentimes in terms of military trauma, but a lot of women in particular experience sexual traumas, and it's sort of an unrecognized epidemic, if you will. So that's a science answer.
It caught me off guard too, so thanks for that. All right, here's your final question, and this one you got to get right. So if you need a shout out, the doctor's here for you.
No pressure, huh?
No pressure at all. All right. Here's your last question, and it's a pretty short one. PTSD is a type of blank disorder. PTSD is a type of blank disorder.
I will say psychological.
That's good. So if you think about how much of a hint can I give him?
You can give him a pretty broad hint.
Okay. Well, it starts with an A, and if you think about sort of the symptoms that you have with PTSD, you feel very anxious.
Anxious. I was going to say agitated, but anxious.
Anxious, yeah, agitated. That's exactly it. So you feel agitated, and we just call that formally sort of an anxiety disorder that it falls under. So.
All right, we're going to give you that one.
I think that's good enough for the win.
It is, because anxiety is a psychological disorder. So we're going to give you that one, Paul. Excellent. Well, Lori Marks of Milwaukee is winning a CTSI prize pack. So we really appreciate your time, Paul. We know you're heading towards the air right now to go on to do the CBS 58 News. And we appreciate you calling in.
Yeah, glad to help out. It's been educational. Thanks.
Thanks a lot, Paul.
All right, we'll talk to you again. One last item. CTSI Discovery Radio airs the third Friday of every month, so make sure to mark your calendar.